Hello and welcome. I'm Dr. Robert DuPont, President of the Institute for Behavior and Health, a nonprofit research and policy organization. Before, I was the first director of the National Institute on Drug Abuse and the White House drug czar under two presidents. And I'm very proud to be with you today. I am joined by our Vice President, Caroline DuPont, MD, also at the Institute of Behavior and Health, and Nancy Pasquale from RIACT Coalition, who is a leader in this field in Rye, New York. We intend our presentation to be useful to you in your work in youth prevention. What we're presenting is a message about youth prevention, not a program. And we believe this is going to be very helpful to you in the work that you are doing.
Thanks, Bob. In any conversation about youth drug prevention, it's helpful to start with what are we protecting? We're protecting the developing brain. The human brain isn't fully developed until the age of 25, making it uniquely vulnerable to substance use. In these images, we see changes that go from the least developed areas of the brain, which are depicted in those warmer colors of red, yellow, and light green, to the cooler colors of blue and purple that show fully developed brain.
Substance use disorders begin with the repeated use of chemicals that superstimulate the brain's natural reward complex. Drugs do this more powerfully than natural rewards, and this can be seen in animal studies where the animals will work harder for the drugs than they will for natural rewards.
And it's important to understand that addiction is most often traced to adolescence. 9 out of 10 adults, 90%, with a substance use disorder began using substances before the age of 18. And importantly, the earlier the person starts to use and the heavier that use, the more likely the person is to develop problems later in life, including addiction.
These graphs speak to what Nancy was just saying, and they show the likelihood of a subsequent use disorder for alcohol and marijuana, depending on what year the young person first used the drugs. And you'll see here for alcohol, if the first use of alcohol is 13 or less, 47% develop an alcohol use disorder or addiction. For marijuana, 13, you'll see it was 17%. But look, in both cases, what happens if the first use is 21, 9% versus 47, and 4 compared to 17. That's very dramatic and very important. This graph shows the past month substance use, and it's very clear that in Americans 12 and older, about half have used alcohol in the last month, 21% tobacco, and marijuana 12%. But look how those three drugs dominate the picture. Look where opioids are and cocaine are in terms of the country. This is for the whole country, and we're going to show you that this is also true for youth.
We know that not every young person who uses substances will go on to develop significant substance use problems. But we also know that all substance use puts adolescents at risk for other problems related to mental health, accidents, sexual assault, and decreased academic success, among other things. We found that young people are really tuned into mental health, much more than they have been in the past. The substance use mental health connection is more widely understood, and young people are really interested in protecting their own mental health. There are many excellent prevention programs, but many of the programs focus on individual drugs. For example, the Truth campaigns focus on smoking. Other prevention programs focus on specific settings or situations, like don't drink and drive or don't binge drink. We're asking you to think about, what are we all really trying to prevent?
To bring clarity and broaden the context of what we mean by prevention, we have framed at One Choice the goal of youth prevention as exactly that, one choice. No use of alcohol, nicotine, marijuana, or other drugs. by youth under the age of 21 for reasons of health. And we consider this a new health standard. So one choice is a health standard in the same way that many others are and that we're familiar with, right? Always use a seatbelt, always wear a bicycle helmet, avoid sugary drinks, eat a healthy diet, and exercise regularly. We know that not every young person is going to do all of these things every day, but that doesn't change the fact that these are the health standards, and we consider one choice to be analogous with these.
All youth substance use is related. When we've looked at the surveys, we see that from on the basis of scientific studies that this is true. If youth use one substance, they're likely to use other substances. So when we're talking about substance use prevention, we're not talking about individual substances or individual settings. We're talking about any use of any of the substances. Here's an example of this, very dramatic data. You'll see here on the left side, what is the likelihood of the use of other drugs for a young person, 12 to 17, who has not used any marijuana. So it's only not used, no marijuana. And on the right side is youth who have used any marijuana, even one puff of a marijuana in the past month. And take a look at alcohol use, and you see it was 8% of the people the youth who had never used, no use of marijuana in the last month. Only 8% had used alcohol. But if they had used any marijuana, it was 44.6%. And you'll see the same relationship across with binge alcohol use, with heavy alcohol use, with cigarette use, and other illicit drugs. In every case, the use is much higher for those people who've used any marijuana compared to those who have not used marijuana.
So this is another slide that is similar in the way it's constructed. So here we're comparing youth who haven't used any alcohol on the left to their peers who have used alcohol at 3 different levels on the right side: some alcohol, binge alcohol use, and heavy alcohol use. And we see the association is also true where past month of alcohol increases that likelihood of using marijuana, other illicit drugs, and cigarettes.
And the same trend holds true for cigarette use. And I think in the case of cigarettes, it's important to note that what we're really talking about there is not the cigarette as the delivery system, but actually the nicotine, which is the drug that is active in that cigarette. And here we see that association compared to their peers who did not use cigarettes at all, youth who used cigarettes in the past month were using other substances at considerably higher rates, 4.2 times more likely to use alcohol, 6.3 times more likely to binge drink, 10.4 times more likely to engage in heavy alcohol use, 7 times more likely to use marijuana, and 7.7 times more likely to use other illicit drugs compared to their peers who reported no past month cigarette use. The critical decision really, and what this data is telling us, is that the most important thing for youth is the decision whether or not to use any of those substances, particularly those key 3 that are the substances most commonly used. And it underscores a need for a clear goal for prevention. And the question that probably is coming to mind for you right now as folks who work in prevention is whether or not, or as parents or caregivers, is whether or not that goal is realistic. And the great news is that we have data that says that yes, in fact it is. And this is data, again, that has been collected over time. IBH has analyzed data from the Monitoring the Future survey. It's a study that shows how the nation measures adolescent substance use behaviors, I think it's important to note in this context that the Monitoring the Future survey is actually a survey that started while Dr. Bob DuPont was the head of the National Institute on Drug Abuse. So we're grateful to his contribution to our field in making this kind of data available to us. And in this graph, we can see that back when the data first started to be collected in the mid to late 1970s, and particularly in the early 1980s, right, that both lifetime and past month use of substances by high school seniors was at all-time highest points, right? The non-use, this is non-use that we're looking at here. But by the time we get to 2018 and 2019, we go from roughly 3% of lifetime non-use to over 31% for high school seniors. And that number went up for past month use to 59%. And that trend, of course, is also true. We see that even more when we look at grades 8, 10, and 12, that the trend has been going on nationally. So young people themselves are actually leading a change that our data is just noticing, right? And that's what we're here to share with you, because we think this is great news, because youth are already there.
We're going to take some look at some history here, but I want to emphasize that change, that growth of the non-use among the American youth was largely overlooked until we did this research. And that is an amazing, powerful trend of 4 decades long that is led by youth themselves. They have changed. The American youth are doing things differently now than they have in the past. And the difference is dramatic increases in the percentage of youth who have not used. Now take a look at this slide. This takes a minute to digest. Just look at the alcohol numbers. We're going to look at alcohol, cigarettes, and marijuana, but just look at alcohol. Back in the late 1970s, 72% of high school seniors had had a drink of alcohol in the prior month. Now think of that, 72% of high school seniors in the late 70s had had a drink of alcohol. Now jump forward to 2018 and 19. See that? That number now is below 30%. That is a dramatic drop in youth alcohol use, and it's been largely overlooked. People don't realize how powerful that change is. It's less than half of what it was in the late 1970s. Now look at the cigarette numbers. And you'll see that notice that it's peaking at the same time as the alcohol and the marijuana. But look at what it's leveled off. It started at about 40%, and then it leveled off at about 30%. And then in the late 1990s, the bottom fell out of cigarette use. And you'll see cigarette use became less than marijuana use in 2008, and it's continued to go down. That's a great public health success. Now look at marijuana. What the number, and it peaked at the same time, all right, up near 40%, and it went way down to nearly 10% in 1992. That was what was called the parents' movement, and it was a bipartisan effort, and it was very dramatic, the effect that it had. But then started the marijuana legalization movement in earnest, and you'll see it came up. But what's striking about it is that it hasn't gone up over that time since '96 very much. It's pretty much flat over all that time, but you notice how different it is from the slope of both cigarettes and alcohol. And that's because of the focus on marijuana as a safe drug, but by so many people. But the key concept here is the downward trend over this period of time. That's the most important thing.
So what Bob just spoke about is the perfect segue to discussing the for-profit marijuana industry that has emerged and is flourishing in the United States. So like the alcohol and tobacco industries, the marijuana industry makes its money off of heavy problem users. And their profit is increased and sustained by recruiting new people to join that group of heavy problem users, and that means targeting the young. These images on the left may look familiar. They're emblematic of the advertising from Big Tobacco for cigarettes, where they would say that, look, it's healthy, it's physician recommended, it's safe to use. And now Big Marijuana is using that same playbook in promoting medical marijuana as if it is legitimately supported by the medical industry. This table it's always been one of my favorites because it was actually put together by a group that supports legal marijuana industry in Colorado. And on the left, it shows us the number of marijuana dispensaries in the city of Denver, totaling 364. And it compares them to things that we're really used to seeing. In this case, Starbucks, that there were 80 of them, and McDonald's, 31. That's just amazing. I just think about that. 364 dispensaries compared to 80 Starbucks. On the right side, it's showing the data for the state. Over 1,000 dispensaries, marijuana dispensaries, compared to 322 Starbucks. And in this case, now we're comparing it to Walmart's, another ubiquitous thing, 106 Walmarts compared to over 1,000 dispensaries. Those numbers are really quite staggering. Now, if we look at this, next way we can look at it, this is a more recent picture from the city of Denver, where there are now over 500 retail stores. So in that other slide, we were showing there were 364, and now it's jumped to over 500 retail stores for marijuana. And so as states see an influx of retail stores, it's important to think about what is that actually doing to their population in terms of what are they seeing? And what have we learned from past experience with alcohol and tobacco industries when you have a prominence of liquor stores and smoke shops, for example, in lower income communities? This really is very important to look at this and think, wait, what does this mean for our youth?
I'm asking you now to take a step back and take a broader look at the problem of drugs and see that what is really involved here and happened to us is commercialized recreational pharmacology. Commercialized recreational pharmacology. What does that mean? That means the superstimulation of brain reward by chemicals that are sold for profit-making industries, and it leads to exploitation, both legal and illegal drugs. In other words, the distinction here is not between legal and illegal, it's between using chemicals to superstimulate brain reward versus not doing that. And vaping was an interesting example of that. It came on as a way of stopping smoking, but became a route into smoking and into other drug use. Other new delivery systems will be developed. Potencies of all the drugs are going up. Prices are going down for the drugs over time. And the bottom line is the commercial exploitation of dependence-producing drugs, legal and illegal. And what we've shown here is that the use of any of the drugs is highly correlated with the use of other drugs. There aren't very many people who just use one drug. Once you've used one drug, you're very likely to use others. So we're talking one choice, and our one choice is very simple. No use of any alcohol, nicotine, marijuana, and other drugs for reasons of health by youth under 21. Why under 21? Because of the vulnerability of the adolescent brain. People get to 21, the likelihood they're not going to use it. So this is a prevention that's going to have an effect all through the lifetime of the individuals we're talking about. One choice for health. No use of any alcohol, nicotine, marijuana, or other drugs for reasons of health under the age of 21.
Substance use is a health issue. It's not a moral issue. So likewise, one choice is about health. It's a new health standard. The one choice message and supporting data supports all other prevention efforts. And as you'll shortly learn, it promotes teen self-care and autonomy and provides an opportunity for youth to take a leadership role in prevention. Youth are already leading the way. One choice gives them that platform. One choice also isn't limited to any one group. It's really important for us to realize that it's not an all or nothing thing. It's not a you're in or you're out. Anybody can make one choice, including individuals who have had significant problems with substance use in the past. Recovery is all about the one choice not to use any substances. And people who have dabbled, who have maybe done something at one point and then been like, whoa, that's not for me. Everybody can wake up today and make the one choice for their own health, just the way you would with putting on a seatbelt. You didn't wear it yesterday, but you can make the smart choice for your health and do it today.
We are asking you to join us in the One Choice community. We have put together a group of people who are doing this. We do it with parents' nights, student-led service announcements, community-wide education campaigns. The One Choice message can be fit to any community in many different contexts. And we hope that we encourage you to do that.
So one of the great things that we've done is we've really found in Rye that we've used we've included a really broad integration of the One Choice message into all of our other prevention messaging, as Caroline said before. So for many of us, where we do need to occasionally have conversations and focus on specific substances because our data is showing us that specific substances are a problem we need to put focus on, we still have the opportunity to weave a One Choice message into any of those other prevention messages that we're sharing with our community. We've done that in a number of ways in Rye. We've done parent universities and parenting for prevention documents that we share with parents. We've done youth speak out events where youth were really the leaders. We've done a Healthy Teen Brain Day celebrating youth who are making one choice to be drug and alcohol free. The key is that in every instance, no matter how we're talking about prevention, that we're always weaving in that message that the use of any substance by teens is connected to the use of other substances, and that our message and our health choice, our health standard is clear, that no use of any substances. And that has actually helped RIACT and our coalition to realize some pretty dramatic reductions in youth substance use over time. So for example, we've seen a 42% reduction in 8th grade past month alcohol use, 39% reductions in 9th grade alcohol use. We've seen reductions in prescription drug misuse across all grades. We've seen decreases in 8th, 9th, and 12th grade for marijuana, all by incorporating this One Choice non-use message, really strong, powerful non-use message. And it's really been our youth leaders who have led the way in terms of that message. As hard as sometimes it is for parents to get on board and talk about it, we find that youth get on board because it matches their experience, right? If you think about those early slides that we saw, it matches their experience. More and more of their peers are not using substances. So we want to share one example of PSA that our youth leaders created. And this was actually created by our One Choice community, youth leaders from across the country who are sharing this message of non-use.
Don't all teens use substances? The truth is, a growing number of teens are making the choice to be drug and alcohol free. You're not alone in making one choice. Join us.
is time for a wrap up. I want to make sure you understand this based on our message is based on the unique impact of drugs on the adolescent brain, a unique vulnerability. Second is our point that all drug use by youth is connected. It's not one drug at a time or one amount or one setting, it's all connected. And then the third point is that the youth are in the lead in making one choice. They are leading the way themselves. It's harder to get the adults to understand this than it is the kids. And we want you to encourage that trend that youth have created to make the one choice, not to use any drugs because of health.
To all the leaders in prevention, thank you for the hard work that you're doing.
We thank you and we invite you to join us and become part of the One Choice community. Feel free to reach out to IBH or to RIAC Coalition if you're looking for ideas about how to integrate these messages or how to join the One Choice community. And we hope that we will see you there.